and everybody must have gone fishing. I don't know. But we're ready to start, and I want to ask Council Frankie Hargis to give the invocation, please.
Heavenly Father, we just thank you for this day. We thank you for the rain that you have blessed us with. And we just ask that you bless everyone with safe travels on the wet roads. We ask that you'll guide and direct the decisions that we make in this committee meetings today. In Jesus' name I pray, amen.
Miss Shelley, would you call the roll, please?
Janelle Fulbright,
Present.
Dick Lay,
Here.
Jack Baker,
Here.
Harley Buzzard,
Here.
Joe Bird,
On him.
Julia Coates, Jody Fishingpot, Don Garvin, Hannah Glory Jordan, Frankie Hargis,
Present.
Lee Keener,
On him.
Curtis Snell, Janice Taylor, David Thornton,
On him.
Victoria Vesquez, David Walkingstick, Kara Cowan Watts. We do have a quorum.
Before we go into the approval of the minutes, I want to congratulate Miss Shelley for being Employee of the Year. It was well deserved. We appreciate her so much and all that she does for us, way beyond the call of duty. So I'm sure everybody's had time to look at the minutes, and I will entertain a motion to approve the minutes.
Make a motion to be approved. Second.
Moved and second. Everybody in favor of the minutes, let it be known by saying aye.
Aye.
Any opposed? The minutes are approved as read. Okay, and then we'll go right into reports. Mr. George Valyers from the Claremore. We're glad you're back.
I'm glad to be back. My apologies, last month we had the union came and camped out at the hospital for the day, and I kind of stuck around to see what was going to pop up with their participation there, so my apologies. Your report, we can see we're still recruiting for internal medicine docs. We're still recruiting for surgeons and OB-GYN docs. Visits are down, but revenues have increased despite visits being down. We just finished the completion of the front door. If you've been to the hospital in the last year, the front door used to open up straight to the north, and it would get really, really cold there with the patients and the employees in the main lobby. So what we did is we took that front door and turned it sideways, so you kind of have to hook around now. We just kind of rotated it, so that worked out well. And now we've started redesigning the emergency room to do a remodel back there and give a little more security and privacy back there. We were surveyed by the Joint Commission last month, had a good survey. We had 3 direct findings and 4 indirects. Those have all already been addressed and corrected. So that went well. Any questions?
Any questions? Mr. Keener?
Thank you, Madam Chair. George, on the revenue for 2015, they're up about 20%, right?
Yes.
And that doesn't go toward the construction, does it? Does it go, well, where does that go?
That can go toward construction, yes.
And in this case, will it?
Part of it will, yes.
What's the other part go toward?
It'll go to the day-to-day operations.
And then on the emergency room remodel, well, that'll have that new card reader and the front wheel too, or just
The new card readers will be throughout the hospital. Any secure area will have the card readers on them, but yes, they'll be there too.
And so what do you count for the increase in revenue this year, or past year, I should say?
One of the things that we've really done well on is our point of sale collection in our pharmacy. They're actually projecting we're going to pass $2.5 million this year. I think they told me that we're actually to the point that we collect enough to pay for our medications that we give out. So that's a big deal for a facility our size. As for the rest of that, I'm I'm just scratching my head trying to figure that out with visits down, but I'm not gonna argue with it.
Thank you, Joy.
Uh-huh.
Thank you, Madam Chair.
Counselor Taylor?
I have two things. The first one is, I hear a lot about the process of booking an appointment.
Mhm.
If you could take a look at that, call at 8 o'clock, we take appointments for an hour or so, and they, people having to call repeatedly to get in. So if you could
Okay.
take a look at that and see if there's some way we can improve that service, that would be great. Secondly, I spoke with a constituent just this morning whose sister had had a stroke and had been immediately admitted to Clemmer Indian Hospital and then had been transferred to a hospital in Tulsa. And she said the care that she got at Clemmer Indian Hospital was way above what they were currently receiving at the hospital in Tulsa. And so I want to commend your staff on that. And that's typical of what I hear about inpatient care at Clemmer Indian Hospital. You're doing a great job there.
Thank you, thank you.
Thank you. Keep it up.
That actually brings to mind, leadership went over to St. John's this morning and had a meeting. St. John's is the stroke center for Tulsa, and we're trying to partner with them so that we can bring some of that stroke expertise down to over to our hospital.
Any other questions? Okay. Thank you for that great report.
Thank you.
Next is Miss Connie Davis.
Good afternoon.
Afternoon.
I'll just highlight some of the report. I'm sure most of you have seen it. Looks like our visits are staying pretty consistent throughout the health system. Loma P. Mankiller, just over 9,000 visits. Redbird Smith, 8,744. Salina, 7,661. J, 5,928. Nowata, 4,659. Muskogee, 12,924. Bartlesville, 1,779. Veneta, 6,968, which every month it just impresses me at how much they are growing. The Godoogie Clinic, 468, and just over 28,000 here at Hastings in Tahlequah. Some highlights, spoke to Counselor Lay just before this, but we had a great recruitment effort back in January, and we've almost completely filled all the vacancies ready for Cooey Scooey grand opening to be announced. And that went really well, so we're excited that we've made that much progress in getting people trained, and so hopefully it'll be a smooth transition getting that clinic up and going. Also, in February, during Cherokee Days at the Capitol, Dr. Brett Gray from the Salina Clinic was recognized as the doctor of the day there, and Brian Hill was recognized as the nurse of the day. So they honored us well and represented us well. The emergency room at Hastings for the month of February, had 6,196 and a left without being seen rate of 2.35. And if you'll remember, the national average is 3%. So they're to be commended for that remarkable rate. Unfortunately, we had a left without being seen rate of 7.34% in urgent care. And we have had a meeting since that time and implemented some pretty significant changes in the provider schedules. They now understand that they work till midnight sometimes because that's the hours of operations. It wasn't real popular, but we have patients to see, so it's trending much better now. The ED arrival to discharge time was 153 minutes, so we're getting real close to our goal there. 362 surgical procedures in February. Dental services saw a total of 5,775. I'm having a mental block today. On the recruitment, looks like we have an 8% vacancy rate. And I'm excited to let this group know that Dr. Gloria Grimm is coming back to work in our urgent care. In fact, she worked last Monday, and that transition's going really well, and we're very happy that she's back, part of our team. We've got some, we've made application for our public health accreditation. I anticipate with the hard work of Lisa Pivick and Dr. Gann that we will get that accreditation, and we will be the first tribe in the nation to have that accreditation. So they asked for some more information and clarification on the initial application, and I look forward in the near months of telling you that we've received that approval. Contract health, on the last page of that report, 98.2% approval rate. So thank you for supporting contract health efforts, and Brett Hayes and several others for the remarkable improvements in the referral process and approval. And just a brief update on the clinics and when are we going to get them open, because I'm asking that every day as well. We're looking toward the end of April, 1st of May for Oshaleta. The holdup there and I know that Counselor Blaze can maybe help us with getting the phone lines agreement taken care of. Having a little challenge with the robotics for pharmacy and lab, but I think we've worked through that even since last Friday when I made my notes. Salisal should be done at May 8th, Stillwell mid-May, and Jay mid-June. So I'm hoping by next Friday we can give you some dates to put on your calendars for grand openings. I would ask if you have dates you absolutely cannot make it, if you would email those to me, that will really help us when we make our plan and be able to schedule it down and make good use of your time and hopefully not be confused over emails and phone calls. We celebrated Doctor's Day on March the 30th, and the docs are getting some nice Yeti mugs that they're very happy about. And a lapel pin that was worn by all the staff that was created by one of our own employees. Really cool. That's my report.
Good report.
Yes, Counselor Buzzard?
Connie, I've got a couple of things here, but I wanted to get a better understanding of how we handle surgeries there at the Hastings. Let me just give you an example. A person goes in and says he needed something done to his shoulders, and he has private insurance. What I'm hearing is this guy may wait 6 months or 8 months to get an appointment for surgeries. What I'm wondering is, when you schedule those, do you look at the age of the person? Do you look to see if they have private insurance? Just how does that work? Because I understand there's a long waiting list for ortho.
Well, a payer source or insurance does not make you a priority over any other patient. You're treated the same.
So if you have, why wouldn't it? I mean, why make a person wait 6 to 10 months?
There
If you've got
should,
insurance when we have this other money where you could just contract him out.
there shouldn't be that long of a wait, so that would be an unusual case, I would say, so, without knowing the specifics. But generally, if you have a shoulder issue, for the example you used, you're referred to our ortho clinic if it seems to be something we can do within our own facility or to one of our contracted providers, and we have several orthopedic docs that we contract with.
And I guess and I don't know, it is a concern that we have a lot of people that has insurance and we see what we can get on third-party billing, but if they go in and need a hip replacement, they have to wait 4 months to get it. They could actually go to a private hospital and probably get it in 30 days. Do you think that's
Maybe.
right or not?
I don't think that's right. I think
Yeah.
we can see them faster. I know I can make a call and get them in quicker than that.
Well, no, you can't.
Just
But
let
I
us
just
know.
had a person call me and they said, we have private insurance. And we could go to other hospitals and doctors, but we have always used the clinics all our lives, and that's kind of where we go for that. And I thought, well, I'm not sure what we're doing, whether if we're looking at how severe the injury is, if we have private insurance, if we have VA insurance, if they have what, or just on the list, and when you get down that list, that's what you said, when you get down to his name, that's when he gets served.
Well,
But it doesn't make sense to me if you've got a person that's got full coverage insurance, can use the VA, and he sits and waits for 4 or 5 months, why not just use some of the other contract health service money and send him out to get it done?
we would still bill his insurance first. Contract health would be the payer of
I
last
know,
resort.
but what I'm saying, he's sitting there with pain for 4 more months.
If you'll get me the name of that patient, I'd like
No,
to.
I don't have his name,
Oh.
you know, he's already got it done.
Okay.
But it just seemed like, I don't know, you wanna be fair to everybody because a lot of people can't have insurance. But
Right.
it seemed like there ought to be another way to get those people off the list and just shorten the list. But no, we're in the business of getting insurance claims too, so I can see some of that.
4 months is something must have happened in that particular case because it would be very unusual to wait that long to be referred
I'll
out.
check, you know, because
Okay.
I have his name, but it's at home and see, just kinda see what went on.
Okay.
The other thing, I brought up to Brian last month, was on diabetic shoes. I understand we don't have a contract for diabetic shoes anymore. And I've had some diabetic people call me that said they couldn't get shoes. And I knew that Brian told me last month we didn't have a contract. Are we trying to get another contract?
We're trying, we still do not have one as of this date.
We talked a little bit about urgent care, and I know I've brought this up several times. And I know it's probably not something you can just do, so, you know, I'd like to keep that on the back burner to where we can have some.
In the outlying
care
clinics? Yes.
I think that would eliminate a lot of patients coming in even during the week. The other thing I wrote down is, and I brought this up to Brian, I wanna tell you too, is the parking lot up there where the ortho clinic is. It's awful. I mean, we got people that's trying to go into the ortho clinic using a stroller and it's gravel and
From-
rocks, and I asked Brian, let's do something, put in the budget, put a little 2-inch overlay of asphalt or we can walk them.
And he has followed through on that. I've seen an exchange of
Yeah.
emails, so we're looking on funding sources and
Okay.
I think we're gonna work with facilities to see what we can do
Right,
about
if we can
that.
Get something in there, cause it's pretty difficult to get
Yes,
a
it
surgery.
is.
And I know it's an overflow parking, but it's always overflowed.
Oh, yeah.
Behavioral health, I've just seen that, had some calls about that. And I know 6 months ago, we had a big backlog and we were told that the backlog was down. How's that going now?
Still going very well.
With the new building that we got, have we started using that?
No, but I think we'll be moved in probably within about 30 days. One part of it will be, there's 2 buildings actually,
How's that?
but one of the buildings I think is ready for occupancy within the next week or so.
Okay, well, that's kind of what I wanted to talk about. I wanted to talk about the surgery really, just kind of see what's happening there.
Yeah, I'd be curious on that
But
particular
I'm
case.
just, I don't know, it's just something about it, you know, how many are in there to get surgeries? You have a number? How many people are waiting?
All right, let me think. I saw a number. She does about 40 patients a month. So, I mean, she has capacity for, if we're doing it at Hastings. So,
Yeah.
and that's not knowing enough about the case, if it's a specialized surgery that we'd have to send out, or if it's something Dr. McAllister can in fact do herself. So, there's so, a lot of,
How many ortho surgeons do we have there?
on staff,
Yeah.
1.
Okay, thank you, Madam Chair. Thanks, Connor.
You bet.
Let's see, who was Nick Lay, okay. And then Thornton and then Keener, okay. Counselor Lay, you're next.
Thank you. Connie, and it may be in here, we used to split out the contract referral percentage success rate between Claremore and Hastings. Do we not do that anymore?
I don't know that we do that so much.
I kinda like, next time if you could, I'd kinda like to see it.
It doesn't look like we did, but we can ask Brett, is it possible to separate that out? The way they come in?
Thank you. Touch base with you after and clarification on what you're looking for.
Thank you. Thank you, ma'am.
Okay. Counselor Thornton?
Yes, I was going to ask you about the new hospital that we want to put at Hastings in that area. Do you have parking lot on the agenda up there? Is it part of
Oh
it?
my, it's gonna be a big parking garage probably.
Sounds good. And about the waiting for 3 months on getting something done, and when you refer somebody, you refer them to a specialist, do you not?
If it's not something we can provide within our own health system.
Well, I know that here about 4 months ago, my doctor wanted me to go see a lung specialist. So he called, and it was going to take 3 to 4 months for me to get in there to see that lung specialist. But it was just lucky that he happened to know this one personally, so he got me right in. But I know that these specialists have waiting lists, and they're just like us. It takes time to get in to see them.
Yes.
I know that you may be in a lot of pain, but I was in quite a bit myself, and I don't know if I'd made it 3 or 4 months. So I was very lucky. Private physician that knew what was going on.
Now, rheumatology, I think it takes, because there's very few of those specialists, it takes about a year to get a patient in. Endocrinology is another one, you know. I think it is a 3 or 4 wait, but if you're in an acute pain situation or injury, you can get in. There's a lot of orthopedists in the state, so that works to our advantage, and we have several contracts, so that's why that particular thing is
I'm not
unusual to
sure.
me.
Thank you.
Yeah.
Councilor Keener?
Thank you, Madam Chair. On the, back to Councilor Lay's question, I would like to see that split out as well, what
The contract health?
yes, contract health. And then I guess my next question is, on referrals, and this would maybe go back to Councilor Taylor's question, and George is still here. Would you walk us through that process if I walk into the hospital and I have to be referred? What will you walk us through that as a patient would see?
Patient comes in, and I'll use myself because I'm insulin-dependent diabetic. And so I go in and I see my doctor, Dr. Harp, and I need my endocrinologist follow-up. She would then generate a referral within our electronic health record, and it goes to our contract health staff. The board reviews those every day. They're approved and scheduled.
Okay.
Pretty much how it works.
If it were only that easy, but.
It's dependent on, a lot of how quick it works is dependent on the doc. They have to write a medical justification that will meet the needs of, meet the criteria for our policies in contract health, but also, are modeled off of a private insurance company. You can't just say, go get a blood test or go get an x-ray because I want to. You have to write what they call a medical necessity justification for anything that's ordered.
And then the step I didn't hear was the liaison with the contract health, Cherokee
Yeah.
Nation. Where do they come?
A lot of the clinics are set up where they see on the same day to verify addresses, and then they help facilitate the appointments of that patient.
And we have one at Claremore right now, correct?
But yes, we have one, well, we have 2 positions, but we are down a position, and I think we're in the process of getting that second one filled. Or did you did hire that second person, didn't you, Brett?
Yeah, but the other one moved to CNE, so
I thought you had a clerk hired this week.
we're gonna have 3 people there. We have one right now.
Okay. Is there a backlog right now, or everything's up to date?
I'm not aware of a backlog.
We're using our staff down here for the overflow.
Okay. Just temporarily to
Yeah.
get to the place. How long we anticipate that'll take to get the 2 up and running?
We're actually looking for an emergency hire to estimate in there this.
Okay, all right, thank you. And then back to the medical records department. Do you have to be a certified coder to work in that department?
We prefer that they're a certified coder,
And that's department-wide, correct?
yes.
Everybody? All right, thank you. Thank you, Madam Chair.
Okay, I've got a comment I want to share with the rest of the council. I sent an email this morning to Connie and Dr. Montgomery and Dr. Steelberg requesting that they change the wording in the form letter that they send out when, for instance, a lot of people in my district live very close to Fort Smith, Arkansas, and they have a big medical emergency, and they go to the emergency room at Mercy or Sparks. And they contact Contract Health within the 72 hours, and then Contract Health automatically sends them like a denial letter. And then when they get that, that sets an alarm off in their head, and they call me or Counselor Thornton, and they're just highly upset. They think it's denied. And I understand how the system works, and they've got to write an appeal, but the whole point of it is we're waiting on them to round up all their medical records and send it in. And I want the wording changed from denied to pending till you get all your medical records in, then it will be reviewed. Because in actuality, 98% of them are approved anyway. But then when they get this letter that says denied and you've got to send in an appeal, that just alarms them to no end, and then they call me. And then I call you, and I could stay out of your business if this was just a little bit of different wording, you know, to give them pending that you turn in all your medical bills, and then we will consider it, and that we have received your emergency room information. Because if you're having a heart attack or you have blood clots or something that's a big medical emergency and there's a hospital 15 miles away, a big major trauma center, they're going there. And they're not going to try to, you know, take an hour and a half drive to come to Hastings. I have that happen to me a lot, and I'm not complaining. I just think we could reword the letter better, and that's my suggestion.
You're absolutely right. Several months ago, the chief asked for that very same thing, and we have a couple of drafts we've kicked around, and what we want to do also is get a dedicated email for them to reference, not Brett Hayes necessarily, but it's a generic email, but also a contact number where they can talk to a live person.
Right.
And not be, because a letter from an entity, who do I call and talk to? And I agree, the language in there, because we do cover 98% of the referrals, is inaccurate. So, Brett, we need to get back on that one. That's something that just falls by the wayside.
Well, I appreciate it if you'd look
Yeah.
into it. And there's one other thing here. You're saying possibly May the 8th for the grand opening at Redbird
No, I think that was the completion of the,
building. Okay, well, the tentative dates that have been sent to me and Counselor Thornton were coinciding exactly with the big grand opening that they're gonna have at the casino, which was the 19th, and May 19th. And I said, we didn't want two major big grand openings within 2 or 3 days of each other in Sequoyah County. We'd rather have them a week or two apart, if at all possible.
we are working with Amanda Clinton and her shop and
Okay.
several others to be sensitive to the other events going on. So that's why we asked if there's
Well,
anything.
Counselor Thornton and I are so proud of that clinic, and we're a first down there on this new clinics of the $100 million. And we said we wanted the biggest grand opening in the history of the world. We wanted barbecue and everything, you know, spread out. Well, we know that CMB will do that for the grand opening of the casino, but we're so proud of that clinic and what it means to us all. We don't want to be overshadowed by CMB.
We don't, you're absolutely right. Because we couldn't have done it without their help, but maybe they'll help us with the barbecue.
So, well, you know, on the casino advisory board, they make fun of me all the time because they say, all she's interested in is a world-class buffet down there at Roland. I said, well, yeah, we're really interested in food, that's for sure. So,
Cherokees like to eat.
but we're really proud of our clinic at Salisaw, and they've finished pediatrics up with the wall murals and the painting of Sequoyah teaching the little children, and it's real beautiful. We're happy with it. Counselor Walkenstick.
Thank you. Connie, I just want to thank Dr. Ritter for coming to Muskogee Schools and giving diabetic management training. That was huge. We had a kid that was near death, and she came. She's a very knowledgeable lady, but please send my regards to her.
I sure will.
Next is, I guess, the dentistry in schools. That is something that you guys send a letter home with the students stating they have insurance, and then bring back to the school, and then we go into the school and offer those services like a teeth cleaning and
Fluoride treatments.
Fluoride treatment and all that. So anyways, we're gonna take advantage of that. A lot of our schools in Cherokee County as well. I was visiting with some elders over the weekend, and they had a small complaint, emergency room. How do you guys schedule doctors in ER, like throughout the week?
There's
'Cause-
a doc, they work a 7 A to 7 P, 24/7. And then there's a mid-shift person that comes in at works 11 to 11, because that's when the influx of patients begins to pick up.
Okay,
in the
and that's
emergency
when,
room.
that's when the, I guess the long wait or whatever took place, it was from 11 on into the morning, I guess. Do you guys have someone on standby if there's like a lot of patients out in the waiting room that you guys could call, bring 2 doctors in?
We have some policies that we've implemented for a callback type system. Dr. Smallwood and Dr. Lowe are real good, and Dr. Ward, I wanna mention them specifically because we get a report every morning on how the ER did the night before, actually every shift. And those are 3 providers that always come in and work extra to help us catch up if we're all the way behind. They do a tremendous job.
So there's a process already in place then?
There is.
Okay.
It's not always effective, but we try.
I understand. All right, thank you, Connie. Keep up the good work.
Thank you.
Thank you, Chair.
Counselor Jordan?
What percentages are federal funding now compared to our third-party billing and, grants or anything that we might be able to obtain other than the federal funding that is provided to us each year?
The federal funding, I would guess, is about,
I'd rather get you a report that has a breakdown. Do we get, varying grant amounts every year or two?
are you talking overall health or specific to?
Well, let's say specific to Hastings Hospital.
Let me verify that with Amy.
I'm just wondering if our federal funding has grown at the same rate that our third-party billing has increased.
Well, the federal funding has been flat the last
For-
3 years.
Okay. Has it grown
Doesn't it-
much since,
Or
has it grown much since
Yeah.
2007?
I'm sorry.
Has it grown much since 2007, or has it just been pretty flat all the way through?
Because of sequestration in 2013, 12, I mean, we lost $8 million out of our budget that year, and it has been a flat budget since that time. So I would speculate, I predict that our third-party revenues have increased because of that, and we've done a better job on billing and collecting. But we can verify that with our finance.
If you would, and send me that information,
Sure.
I'd appreciate it. Thank you.
David? Did you want to
Yes,
say?
are we taking on new patients at Redbird Clinic now?
I hope so. We've got a new doctor down there, and seems to be doing well, so we should be able to see more patients.
The new extension is great, it's fabulous. I really enjoy going to the doctor down there.
Well, good.
And I enjoy my Dr. Jones, she's helped me down there. But, the way it's set up with the lab and everything right there, and then your, medication, you've got a large area to go get your medication. It's just great. It's just completely different than all it was.
I'm glad to hear it's
And
working.
I'm kinda anxious to see what the other building is gonna look like, what all's gonna be in there.
Have you used the drive-through pharmacy?
No, I'd usually order, mail,
Oh,
but I have gotten medication there and it's, I've waited too long.
well, they put a lot of thought in that, and I'm glad to hear it's a positive experience from a patient perspective.
Us kinda older patients and patrons, we enjoy the new one.
Good.
Thank you.
Connie, do you have any idea how the physical therapy department's coming along?
End of May, or end of April.
Good.
That's quick.
That's great. That's great.
Waiting on equipment for the most part, I think, right now.
I know this sounds like a broken record, but I'm with Counselor Buzzard. All of us in the outlying areas need extended hours for urgent care at these clinics, but we're still 2 physicians short at Redbird, and until we can get them fully staffed, there's no way possible we can have extended hours. So we're hoping for that in the future.
We are too. I think it have a big
And
impact.
I don't know where Dr. Montgomery's gonna find these two new physicians, but I hope he comes up with something to entice them.
I do too.
Counsel.
Hey, Connie, about the comment that was made about the orthopedics at Hastings. Yeah, take care of that parking lot if you can. Sometimes here in Cherokee County, we're neglected, and we would appreciate what Counselor Buzzer made that comment. But I was in Washington DC over the week, just got back, and probably had 150, and Counselor Baker was there at large. And, you know, when I got sworn in '87 as a council member, we were elected throughout Cherokee. We didn't distinguish between Cherokee County, one county, so we represented everybody. I still have that mindset about me. It's hard to separate a Cherokee. We're not doing blood quantities, we're talking about representation here. And when Chief was giving his talk there in DC, when he mentioned health care and started talking about Redbird Smith Clinic and Hastings Hospital, the loudest applause, of course, came when he talked about that. People were sitting beside of me. I just happened to ask them where they were from, their last name. I don't know if I want to divulge it, but Sequoia County, Sallisaw. They said, we want to thank you for the new clinic there at Hastings Hospital. And I'm walking down to eat in the restaurant there, and the lady stopped me, and she said, thank you for those kind words, because they asked me to say the blessing. And she was from a place called Nycut, Oklahoma, and said, thank you for the clinics. So even though that those people that have moved away for careers or whatever, you know, for the opportunity was, they have kinfolks back here, and they benefit one way or another through their ancestors. And so that's very important for us to remember that. You know, we're always talking about Cherokee as a nation, as a unit. And that's what we always need to keep in perspective, that yes, it may not benefit that person physically that lives in Houston, Texas, but probably their kinfolks here directly benefits from that. So I just want to commend you on what you guys are doing in the healthcare and all the docs. We just need to recruit more. If it's the pay that we're lacking, maybe you need to bring it back to the council. Thank you, Madam Chair.
Thank you. Yes.
I'm so happy to hear that Dr. Green is back. And I'm excited about the fact that she will be helping us with urgent care. Will you convey that message to her?
I sure will. I think there's a couple in the audience that shares that as well.
Councilor Buzzer?
Connie, I just want to go back to the diabetic shoes. I know you said we're still looking for, are we still looking for a vendor? Actively looking for a vendor. But I've had 2 or 3 people in their shoes,
I suspect it may be a challenge. I believe there were some changes to the reimbursement from insurance, and I'm going to speculate that may have something to do with the lack of providers now willing to do that.
And I just want to echo Councilor Burke's statement about, you know, we use Hastings Hospital, we use Claremore, actually I'm in the Claremore service. You know, I feel like I represent people all over the Cherokee. They call me from Sequoia County. I'm certainly going to take their call and check on what they need to get checked on. So, and that's why with Hastings Hospital, we really need that parking lot fixed. So, do what you can. Thank you.
I want to commend George Valier on his accreditation through Joint Commission, because I've been through those many times. They're not easy, but I got a message over the weekend from Brian Hell. He was doing his flight nurse duties. He can't let that go. But a bigger hospital in Tulsa had lost their accreditation for their ICU. And so it's having a big impact on even, you know, people here, because we depend on those tertiary hospitals to send our patients for people or services we don't have. So good job to George and his staff.
Any other questions or comments for Ms. Davis? Well, thank you for that wonderful report.
Thank you.
Moving right along, we've got old business. We have none pending.
Can Dr. Mayer speak for a moment, please?
Certainly, always welcome. We will look forward to, I went over and shook his hand a while ago, and I know he's the infectious health specialist, and I said, well, you mean I want to shake my hand? I don't take my flu shot, but I do wash my hands all the time.
Good afternoon, everybody. And very short, and summarize it. So I'm here because on May 19th is Hepatitis C Awareness Day, and June 27th is HIV Testing Day. And we've been working with the administration very hard on both diseases and have accomplished many things, but we're not there yet. And I come here to ask for your help in increasing our screening efforts. And in summary, hepatitis C is a disease that damages your liver and can kill you 50% of the times, and we can cure it, and we can offer all our citizens treatment. And HIV leads to AIDS when it's not diagnosed, and we can't cure HIV, but we can prevent AIDS by treating people who have HIV. But the first step, which is the critical step, is screening, is detecting, see who has it and who has not, and who doesn't have it. All our clinics are capable of screening for hepatitis C and HIV in Hastings Hospital, and all our providers have been educated, and they've increased their screening rates dramatically over the last 2 years. But there's many people who don't access the primary care providers, or don't come to the hospital, or don't come to the clinics. So we need to get the word out there and educate our citizens that they need to be screened if they meet screening criteria, which is basically an age criteria. And I'm here to ask your help on any ideas how we can reach the citizens and have them get their screening test done. Just to finish, the WHO has a goal, which is to screen 90%, treat 90%, and cure 90% of everybody who has hepatitis C and HIV by the year 2025. And we want to, also accomplish that goal. And if we can do it before that, it would be even better. So I'm just here to ask for ideas. And you can email me or call me, or I'm at your disposition for whatever you want, and to see how you can transmit this to your constituents of getting screened for these two diseases. That's all I have to say.
All right, thank you.
Yeah.
Yes.
Sir? Is there any type of vaccine you can take for hepatitis A and B?
Yes.
Or C? Okay.
Yes, there is vaccines for A and B, yes. And most of the young people get the hepatitis B as part of their, and A as part of their routine vaccination. But if you're older than, I would say roughly 18 or 20 years old, you might not have gotten that chance, and you might not be immune.
How long will that vaccine last?
For lifelong immunity.
Thank you.
You're good. Any other questions?
That's good. Thank you.
Thank you. Okay. Councilor Buzzard.
I had another question for Connie, and she can answer it real quick. We had talked about cancer last meeting, I believe, and I had asked to see if we could get numbers for the stage 1, 2, 3, or 4. And I guess I think Dr. Montgomery was here last meeting, and I'm just curious about like stage 4 cancer. We don't track any of that stuff. We track cancer, but not the stages. So if we could try to put something together, in the future, I'd like to see that report.
I told you that we'd have something by this meeting. I'm sorry we don't have that information yet, but it's due to gather information from our partner at the University of New Mexico. And I spoke with our director of the cancer registry, Dr. Khan, this morning, anticipating this meeting, and he says that we will have that information by the next meeting. And I apologize if we don't have it today.
Okay, thank you. Thank you, Madam Chair.
Okay, we have no old business pending and new business none. But Councilor Buzzard rang a bell with me there that I want to bring up to Dr. Montgomery and to Ms. Davis, and that's about cancer care. So I think last month they said we had 7,000 patients with cancer in our system, and it's been my suggestion, I've asked for this several times, for every clinic to have a cancer care coordinator to help with all the referrals and everything. That at Redbird one time we had one, and she worked a half a day doing that, and I think a half a day giving immunizations. But then I think right now it's mainly just the breast cancer care lady. But everybody that has cancer is referred out to a professional somewhere with oncology or whatever. And a lot of times, those referrals are given in 3-month intervals, but it's totally up to the patient's responsibility, and they're sick, and a lot of times they don't have anybody to help them that much, and they may get up there and their referral has expired and they don't even know it. And I just think we could handle our cancer patients a little bit better if we have the funding to do it. I would like for us to, I know that Dr. Street at the Tulsa Cancer Institute has met with Dr. Steelberg several times here lately about duplicating of services and how they could save us a lot of money, which they're working on that. But cancer does take up a lot of our time and money, and it's such a scary word, but anyway, we could make these people better about their treatments and a little bit smoother with their referrals. I think it would be a great improvement. That's all I have to say about that. Yes?
Can I expand on that? It was just recently, I think I brought to your attention a case where the gentleman had waited a month after they told him he had cancer. He was still waiting a month later to get referred out. And I can only imagine the anguish that he was going through once he hears he's got cancer and we're still waiting a month later to get somewhere to get the issues addressed. We've got to expedite that. I know you have a fantastic patient advocate here, Star Lynch, because I can just call Star and Star can look into the case, and that same day almost, and it is just literally that same day, she will get the pipeline cleared. But we really shouldn't have to be doing it that way. It really should be automatic. If they're diagnosed with cancer, I can think of another one that was even before that referral, where the lady was waiting, and she was in maybe a stage 3, going into stage 4, and we needed to get her out quickly. And I think we were a little slow both times. And I think we can do better. I know we can do better. Health to me is like a moving target. It's never going to be perfect because there's always going to be new issues come up. Every day that you open the door, there's going to be a new issue. And our success is judged by how quickly we react to those issues. So I agree completely. We need to see if we can't fast track cancer patients out to specialists. We know they're going to go there. So we should have a mechanism by which we can do it quicker than we're doing it. Because they're living with it every day. The one gentleman said, it's growing inside me. I know it's growing inside me. You all know it's growing inside me. I need to be at the next step. I needed to be there the next day. And I think we have the ability to make that happen. I would join with our chairperson in asking you all to bring back the process of how we're going to expedite that to our next meeting if possible.
Thank you. Anyone else have any comments? Well, we've had a great meeting today and brought a lot of great subjects up. And our next meeting is set for May the 11th, and I'll entertain a motion for adjournment.
Adjournment.
Okay.
Second.
All in favor of adjourning, say aye.
Aye.
Any opposed? We are adjourned.
10 minutes, Kurt.